Benton, KPRC, Local 2.
70 million people suffer from acid reflux. The heartburn, indigestion, nausea, and some of our favorite foods can make it worse. Tonight, Local 2's Rachel McNeil is looking at a new procedure to get rid of it for good without medication.
There's nothing like a delicious, hot, spicy meal, but for millions of Americans, they pay for it afterward.
I tried just about everything I could to not be in pain.
Pearland husband, father of 3, and marathon runner BJ Sexton began suffering from gastroesophageal reflux, or GERD, when he was in his late 20s.
I love Mexican food, and I used to eat it, oh my gosh, like almost at least once a week. And there was a point during this process where I went like 6 or 9 months without eating Mexican food.
He tried avoiding his favorite foods, sleeping slightly upright, and several medications.
Just knowing that you take a pill forever was just, for me at early 30s, I didn't find that very acceptable.
An engineer, BJ did his research and found out about a little-known outpatient procedure to treat GERD called Stretta.
Patients I've treated usually are back on regular food within a week.
Dr. Brian Duncan is chief of surgical endoscopy at Houston Methodist. He says GERD affects some 20 million people on a weekly basis.
Unfortunately, all the good things in life cause reflux, so alcohol, caffeine, chocolate, all those kinds of things, fatty foods.
He explained where the problem starts.
There's a valve between our esophagus and our stomach, a one-way valve that is supposed to let what we eat or drink pass into the stomach, but then close so that it doesn't wash back up into our esophagus. That's the valve that's malfunctioning in reflux. It's opening when it's not supposed to.
Medicines can help, but some patients, especially women, are concerned about long-term use leading to osteoporosis. Another option is anti-reflux surgery, where a new valve is created. While effective, it is invasive and aggressive. Somewhere in the middle is the Stretta procedure.
It's done under sedation, not general anesthesia. You go home later that day.
Dr. Duncan uses a catheter with tiny wires on the end to zap the problem area. No incisions, no scars.
And it's meant to cause the collagen in the tissue to contract.
Nearly 90% of patients say after the Stretta procedure, they were able to kick their medications for good.
Very happy, very happy. I love Mexican food, so it was really good.
Dr. Duncan says more and more insurance companies are covering the Stretta procedure as long-term data show it gives patients relief while reducing their dependence on pricey medicines. Rachel McNeil, KPRC, Local 2.
Well, it seems not everybody is laughing.